Hello, everyone. Welcome back to my video series, Code to Care. I again am pleased to welcome Peter Lee, Dr. Peter Lee, the head of Microsoft Research, to the series. I'm going to welcome him in this circle here. Peter, it's great to have you back. Welcome.
Hi, Don. I still get a little bit of a thrill of being brought onto the screen this way.
Yes, well, it's great. It's a new way to appear. It's exciting. So one of the things I wanted to talk about is you wrote this great book a year ago, The AI Revolution in Medicine. We bought that for all of our employees. We wanted everybody to sort of appreciate the wonders of Gen AI, kind of like the way you went through it with your co-authors. And one of the things I enjoyed about the book, which I personally experienced, is just these aha moments. Like every month, I would get into Gen AI and it would just do something, magical and some big leap forward. And that book really represents, I think, you and your co-authors really kind of forging that trail for the rest of us in the industry. But the trail has continued even past writing the book. So I wonder if you can reflect on the aha moments, maybe key ones in the book, if you'd like to recount those, but certainly since, what have been the moments that Gen AI or AI in general has really amazed you?
Sure. That book we wrote in secret in the fall and winter of 2022. And so it's now, what, 2.5
Sure,
years,
sure.
more than 2.5 years. But, it was also, that means it was written before GPT-4 was revealed to the world. And so when I reached out to Zach Kohani at Harvard Medical School and then to Carrie Goldberg, who's a great science writer, we really wrote a book that was a work of pure speculation. There was no real experience or evidence out in the world of what doctors and nurses and hospital administrators and so on, patients, would be using AI for. We just had to guess. And, some things seem obvious. The whole idea of AI scribes
Sure.
seemed obvious because way back in 2017, here at Microsoft Research, we started a project called Empower MD to create an AI that could listen to a doctor-patient conversation and set up a clinical note. And that project was really a very important project because we had two collaborators. We had Joe Petro and his team at Nuance as a set of collaborators, and we had Dr. Shiv Rao at the University of Pittsburgh Medical Center as a collaborator. And so it was a kind of a three-way collaboration. And as time went on, and secretly within Microsoft, we were seeing the potential of generative AI, but we weren't at liberty to share that with either Shiv Rao or with the Nuance team. And then, of course, they had their own secrets that they weren't able to share with us. We started down the road of trying to join forces and, in fact, did a merger with Nuance. And UPMC Enterprises, their venture arm, agreed to provide seed funding for Shiv Rao to spin off his own company for ambient clinical intelligence called Abridge.
Abridge, of course.
And so it's kind of an amazing thing that we could predict that things like this would happen and be superpowered because of generative AI, but also for us at Microsoft Research to see leading products like Nuance Dragon Copilot or Abridge doing so well in the marketplace. I think, honestly, though, in the book, while it seemed for sure that this was going to happen, the actual emotional and cognitive impact on doctors and nurses who have embraced this technology, I didn't really understand the true emotional toll that things like note-taking and responding to patient emails and so on was taking on clinicians. And so to just see that in real life has been incredible. A colleague of mine at UC San Diego Medicine, Chris Longhurst, related a story about this that really struck me. He explained an obvious fact that patients sometimes are very frustrated with their healthcare. and can send some pretty angry emails to doctors.
Ah, yes.
And it can be hard for a doctor to stay even keeled, during pajama time, responding
Sure.
to those
Sure.
things. And the idea of AI having infinite patience to stay even tempered and provide useful responses, I think, is something that, even for the obvious thing like ambient intelligence, has been a later aha moment. And of course, I think the bigger thing has been something we missed completely. I didn't really understand or realize at the time we were writing the book, was how the transformer architecture that powers things like ChatGPT can make huge advances in other modalities such as radiology, pathology, genomics, biomolecular dynamics, real-world clinical data. And so just that generality of that AI architecture and its potential to do in those fields what it is doing for conversation, I think, has been a big aha moment that way back in the fall of 2022, I had no ability to foresee.
Yeah, maybe I could have you elaborate on that, because I've seen you talk about this, that we kind of built that transformer architecture to understand language. But what you're finding at Microsoft Research is that it's really kind of understanding biology or understanding kind of the natural world somehow, even though it kind of wasn't built for that. Maybe you could elaborate on some of the
Yeah,
cases where this
yeah,
architecture
happy
has
to
worked
do
with.
that. The transformer that powers ChatGPT has a foundation model, a pre-trained foundation model that has been trained for only one task, which is to predict the next word in a
Right.
conversation.
Right.
And yet, on top of that foundation, you can do post-training and fine-tuning for a multitude of other applications, like a chatbot, but many, many others. Well, that idea of a foundation model that can be generalized through post-training has turned out to be viable in other domains. So, for example, if you want to do biomolecular dynamics, one of the ideas is imagine running those classical Fortran simulations to do, let's say, protein folding.
Mm-hmm.
Hopelessly slow, impractical, but very precise. Well, you can run those simulations to generate training data that time step by time step, nanosecond by nanosecond, gives you the changing configurations of a protein as it's folding, and feed that into a training system to train a transformer to do the next configuration prediction in the same way that we do next word prediction. And the shocking thing and the exciting thing is that actually works.
Yeah, that's amazing.
And so we don't quite have the internet scale data yet for that, but we can convert electricity and those Fortran codes into that internet scale
Sure.
data and start to train transformers to do that. And that gives us a foundation model then that just does that kind of configuration prediction. And now we can start to try to imagine what kind of post-training, what kind of fine-tuning for specific applications, say in
Right.
drug discovery or in disease diagnosis we might, or materials design, chemistry, chemical engineering that we might have after that.
Right. Amazing. Amazing. Well, great. Well, thank you. Thank you for joining us today. Hope to talk to you again soon.
Thank you, Don.
All right. That's it, everyone. I'll talk to you next time. Bye.